Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. We're in studio today with Dr. Thomas Lee, who joined Press-Ganey as Chief Medical Officer in 2013. Press-Ganey is a company that surveys hospital patients, and he's also an author, the author of An Epidemic of Empathy in Healthcare, How to Deliver Compassionate, Connected Patient Care That Creates a Competitive Advantage, published by McGraw-Hill, November of 2015. He's here today with us as a returning guest to talk about the need for an environment where patients are tended to and priority one for doctors, nurses, and clinicians. Welcome to Health Professional Radio. Dr. Lee, how are you doing today?
Very well. Thank you for having me.
You're the author of An Epidemic of Empathy in Healthcare. You're also the Chief Medical Officer of Press-Ganey. You're with a company that surveys hospital patients, getting their opinions, finding out what they like, what they don't like, how they think that their care, their experience can be made better. Is this something that you were always involved in, thought about when you were in medical school, or is it something that formulated in your mind as you saw the experience of patients pretty much deteriorate over the years?
It's interesting, and Press-Ganey has been evolving, as have I, and Press-Ganey does much more than collect information from hospital patients. There are patients on the outpatient sector, patients having outpatient surgery, and every setting, and we also collect other kinds of data. But really, what we're about is the same thing that I hope I've been about in most of my career, which is trying to make the healthcare system work, trying to make it better in meeting patients' needs, and the chance to have something to say about what gets measured and how that information gets fed back. That seemed like a pretty good way to have impact on a big scale. So that's what sort of led me to where I am today.
It seems to me a little bit contradictory. Here you are, on the one hand, working hard to improve the experience of the patient as far as being empathetic and putting yourself in the situation of the patient. But telemedicine, which seems to further separate, while, being convenient, it seems to kind of drive a further wedge between that closeness, that connection between patient and physician. What are your thoughts on telemedicine in general?
Well, I know that we're going to be figuring stuff out as we go along, and that what my kids are going to want from healthcare is different from what my mother wants. But it's very clear that people want contact. That they want to be able to trust that they're going to be able to reach someone who can help them when they need help. And it's great to have someone face to face with me. It's great to have a chance to touch them and let them touch me, so they know that there's real contact going on. But a lot of times, that's not the best way to get things done. So, before I got on the call with you, I was, doing, electronic communications with patients, and I was sending out some I was answering their queries. Others, I was just sending little messages saying, just checking in. How are things going? Mm-hmm. And that kind of little check-in, so they know that I and the healthcare system I work in are thinking of them, worrying about them, are there for them. That's the kind of thing that, frankly, makes them feel loved, and it makes them more likely to stay with us, and also it makes their care better.
Talk about levels of empathy. You have a hospital that's been there for many, many years. You have a medical practice down the street. You've got an urgent care center a couple of blocks from there, and you've got a hospice home around the corner. Are we talking about being empathetic in levels? Because some of these practices are set up to get you in, get you triaged, to get you out and on to the next one. You don't have time to actually feel.
Well, I think that, we've done a lot of research with my colleagues and I, Press-Ganey, looking at real data, and it's extraordinary, actually. What we're finding is that in every setting, patients value the same things. What they want is they want good clinicians. They want them to be working well together. They want teamwork. They hate poor coordination of care. They want the feeling that people care about them. And then they want good communication about what's happening. And after you take those things into account, what we found is that waiting time actually does not matter to patients as a driver of their likelihood of recommending a doctor or, a hospital or an emergency department. Pain control doesn't matter. Patients aren't expecting zero waits. They're not expecting zero pain. But what they're hoping for is that someone cares about them and is going to listen to them, is going to talk to them. And I think that in every setting, that is important. Actually focusing on the patient, taking in what's important to them, telling them what's going on. And, that doesn't take hours. It does take energy. And mustering the energy for that emotional labor, that's a lot of what we have to try to make happen systematically.
As a physician yourself, have you heard of any of your colleagues transitioning to concierge medicine for this particular reason, so that they can have more time and more of their own resources to enhance the patient experience and offer better care?
Oh, sure. I've had some of my friends move into concierge practices, and I've had some of my friends leave medicine because they felt that the pace and the demands were not what they could thrive with, and so on. And I think that I don't fault any of them, their choices. But I don't really think that the concierge practices are systematically more empathic than the care where where I practice, where my visits are 15 minutes for a return visit routine. That's what's on my schedule. I don't think the patients are systematically happier, and I don't think the clinicians are systematically happier in that concierge setting.
You frequently lecture on the patient experience and strategies for improving the value of healthcare. When you're talking to a hospital's administrative staff or a student body, do you ever focus on maybe the importance of specializing when it comes to your empathy? Say if you're a pediatrician, if you're going to pediatrics as opposed to geriatrics, empathy isn't all inclusive. One size doesn't fit all.
Well, the truth of the matter is there are things that we can learn from colleagues in other disciplines, and including non-healthcare disciplines. But for example, like the pediatrics folks, they know some stuff that we in adult medicine, ought to imitate. They routinely open their rounds in the ICUs to patients' families. They don't exclude them. They say, come join us on rounds. They do things like when a child dies in a lot of hospitals, like 1 year later, they'll have a ceremony. They invite the family back, and the clinicians, the doctors and nurses who took care of the patients, meet in the room, and they just sort of honor the memory of the child who died. And it's not just for the families; it brings a certain closure to for the clinicians. So these are things that are going on in pediatrics. Now, could we imitate things like that in adult medicine? Could we have good family meetings the way they have them in pediatrics? I think in geriatrics, we ought to be having those kind of family meetings all the time. So we can learn from each other and learn from other disciplines.
Now, in your book, An Epidemic of Empathy in Healthcare, How to Deliver Compassionate, Connected Patient Care That Creates a Competitive Advantage, how much do you address the patient experience, not necessarily the empathy of the physician, but how a patient appreciates the technical expertise, how the patient appreciates the training that the physician has had, how they appreciate them being a doctor sometimes as opposed to being a buddy?
Oh, I think that there definitely is a lot to what you're saying. And I don't think that patients come to see me because they want me to be their friend. They don't want to be they don't necessarily want to be taken care of by someone who might be, sitting at the next bar stool, watching the football game. They want to have someone that they can trust. And, that's why being in healthcare is such a very special responsibility. Patients want to trust you. And then, you better earn that trust. You better be as reliable in your excellence, in your safety, and your coordination, the way you work with your colleagues, so that, they can have confidence that things are as good as they can be. It's a special respect that you get in healthcare, and, I think we have to earn it.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. We've been in studio this afternoon talking with Dr. Thomas Lee, Chief Medical Officer of Press-Ganey, and also the author of An Epidemic of Empathy in Healthcare, How to Deliver Compassionate, Connected Patient Care That Creates a Competitive Advantage. Tom holds a bachelor's degree in history and science from Harvard College, a medical degree from Cornell University Medical College, and a master's degree in epidemiology from Harvard School of Public Health. And he's been here with us discussing the importance of creating environments where patients are tended to and become priority one and remain priority one among doctors, nurses, and clinicians. It's been great having you here with us today, Dr. Lee.
My pleasure, and it's been fun for me too.
Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to our podcast on iTunes.